So how do you take all this new data and principally because of the new approvals, how do you take the PRIMA data and the PAOLA-1 data and apply it into your clinic? And I think the ASCO guidelines that came out on August 13th are reasonable. I believe that for me, it really starts with what are you going to do with bevacizumab? If you're a big Bev user, then there's real opportunity there in your HRD positive patients to combine that with olaparib. If you're not a big Bev user, or if your patient in a particular scenario is not someone in whom you'd want to prescribe bevacizumab, then of course you could use niraparib in all comers. And the guidelines were pretty clear from ASCO that niraparib really should be used in the HRP group or considered in that group and offered. And then, of course, you have the BRCA group, and in the ASCO guidelines, they actually were proscriptive, saying that olaparib should be used. I do think because of SOLO-1 and the data that we've seen, olaparib is a fine choice. However, I think niraparib probably works well in that setting also. So I think you have choices there. And I do think that it really starts off with what are you going to do with bevacizumab? And if you're not going to use it, then obviously niraparib would be an agent that you could use in all subgroups. And maybe the totality of the data slightly favors olaparib in terms of the SOLO-1 plus what we've seen from the other studies. But I think you do have choices. And I think that we'll get secondary endpoints that'll help define this even better. And these secondary endpoints, of course, will include overall survival. We'll get longer-term data in terms of toxicity. We saw with SOLO-2 the increase in myelodysplastic syndrome and AML. So we'll really have to look at that in terms of seeing if that's an agent-dependent effect from the frontline studies as we move forward. So these secondary endpoints are going to be very helpful in long-term follow-up. But for now, I think we have a lot of choices, and I generally agree with the ASCO guidelines that have been issued.